because we saw the numbers spike. And once we saw the numbers spike, behavior started to change again. And now we see the numbers declining. But that doesn't mean that we don't have several people every single day that are testing positive for the virus. And that doesn't mean that some of those people, sadly, have lost their lives. And we anticipate seeing more. Only we can be the solution to this big challenge. And just think about it. When we first started off, the big conversations were around PPE and testing and other things, and we've definitely come a long way, although it's clear that due to what I believe a lack of federal response and coordination with our state and our cities, it's been very difficult for so many of us. But we didn't let that stop us. We prepared, we worked hard, we redirected resources, we redirected staff from all over the city, and we adjusted to our situation. And because of that, San Francisco has been a model for the rest of the country, but I want us to be even better than that. So it's up to us. It's up to us to change our behavior. It's up to us, especially because when you think about it, sadly what we see in terms of businesses not being able to open, some of our favorite restaurants and retail shops and places where we get our hair and nails done, they may never return. People who need to send their kids to school because we, regardless of the achievement gap and the equipment we're providing and the support for low-income students, we are still seeing problems and an increase in the achievement gap. So we have work to do, and I'm asking people in San Francisco to just really change their behavior. I know it's not easy. I know we want to enjoy ourselves, but it's up to us to make a difference. And today I want to really talk about our budget and the proposed budget that's working its way through the legislative process as we speak. Part of why we are investing $446 million in this upcoming budget to respond to COVID has everything to do with the understanding that we are going to be living with this for some time. That's money that I wish we could divert to other things, but unfortunately, this is the reality of today. And I hope that that's not the reality of our next budget cycle. We're committing about $93 million directly from the general fund. And so, again, that's money that I wish we could be diverting to other places. And the fact is, it's going to be important that we're prepared and we're doing what's necessary to keep the public safe. So today, I want to just get into our slides now and talk a little bit about our investments so that you can have a clear understanding of why, what's being invested, and what's happening with our response based on our budget. So let's look at exactly what it is that our response is this year in the budget. It includes $16.5 million in funding for communications and operations, $185 million for our health response, $62 million for food distributions and programs at our pit stops, and $183 million for our housing and shelter programs. It's important to remember that this funding really assumes that we don't see any major surges. If that happens, we will need to divert even more resources. And that's why it is so critical that everybody does their part to stop the spread. It also assumes that we will continue to be reimbursed by FEMA. And you all know how uncertain the federal government has been, unfortunately. This also assumes that we use the Federal CARES Act Relief Fund. And this is only through June of 2021. That's right. This is only for the next year. If this stretches beyond June, then there is going to be even more of a drain on our budget next year. The funding for communications and operations is critical to not only staffing our COVID command center, but also providing public information in the many different languages in San Francisco in culturally competent ways. We know, unfortunately, that 50% of our cases in San Francisco have been in our Latino community, despite Latinos making up only 15% of the population. And the Bayview, Tenderloin, Mission, Excelsior, Visitation Valley have the highest rates of cases in the city. Communication is key in a public health response, and thankfully, we have an incredible team of people at the COVID Command Center doing this work every single day. $185 million for health operations is a lot of money, but it's important to understand in the context of all the things that we're doing as a city. We're talking about testing, PPE, surge capacity, preparations, contact tracing, community outreach, outbreak mitigation, and everything else that is required to fight this virus and keep our residents safe. We have massively expanded our food distribution to people in the city, and we intend to keep doing this as long as needed. That includes $46 million in funding to keep people fed. And to address sanitary conditions on our streets, we're continuing funding for the staff pit stops that we chose to expand citywide for an additional $16 million. As you can see from the slide, this is a significant investment in short-term options to get people off the streets. This includes continuing to fund hotel rooms and RVs for shelter in place and quarantine, as well as congregate settings. But we also know we need more housing for people, which is why this all feeds into our homeless recovery plan to create 6,000 placements for our homeless residents. These are absolutely critical for our plan to work. Building on some of our existing programs as well, including our wage replacement, mental health and housing programs, continuing to invest in, as I said before, our culturally competent outreach and our educational efforts to support our public schools, our targeted testing, including mobile testing for neighborhoods that are disproportionately impacted, and of course, prioritizing food access in the hardest hit districts, and especially for our seniors. So these investments in our budget this year, as we know, are absolutely critical in order to get us through this very challenging time. And I can't reiterate enough the need for us to make changes to our behavior. I don't know about you, but as I said before in some of these press conferences, I was a very challenging kid to deal with for my grandmother who raised me. And I can remember time and time again when, you know how it is with parents, how you tell the kid not to do something over and over and over again? Like, don't touch that fire, don't touch that fire, don't touch that fire. And you're like, I wonder what the fire feels like. You touch the fire and you're like, oh, I'll never do that again. That was the kind of kid I was. And the thing is, I know that it feels like I'm a parent telling people in San Francisco over and over again, wear your mask, socially distance, do this, do that. But really, this is about protecting public health. This is about getting us back on track. This is not just a problem in San Francisco, it's a problem all over the world. And when you think about it, there are some countries in the world that have reduced the virus and gone back to normal. That's where we want to be. And the only way we're going to get there, the only way we're going to be able to open the gyms, the nail salons, and the places that we all enjoy and love and send kids back to school and visit our parents and grandparents and others at senior homes and places that they are housed, is if we change our behavior. We listen to our public health experts, especially in places like Dolores Park, especially in places where we know people continue to gather and not socially distance. From our contact tracers, we know that many people who are contracting the virus are contracting the virus because they are having gatherings. They are having family gatherings and birthday parties and other events. And you know what? Today is my birthday, and I wish I could have a birthday party. Everyone's asked, what am I going to do? What am I going to do? Well, I'm going to socially distance myself and talk to people on Zoom. And that's what we need to do. Just imagine if we all did our part. If we all did our part, where we would be today. That's what this is about. And I know you're tired of hearing it from me because I say it time and time again, but I can't reiterate enough the importance for all of us to do our part to get to a better place. We're responsible for it. We've been a leader, and we can crush this virus if we all do our part. And with that, I want to ask the Director of the Department of Public Health, Dr. Grant Colfax, to please come forward now. Thank you.
Well, good morning. I'm Dr. Grant Colfax, Director of Health. Happy birthday, Mayor Breed, and thank you for your foresight and commitment to the city's needs when it comes to our COVID-19 response. Our swift and early interventions, such as shelter in place, protected San Francisco from an initial serious surge of COVID-19 cases. And our investments in testing, contact tracing, community outreach, and food security, among other items, have helped San Francisco manage to slow the spread of the virus. Thank you again, Mayor Breed, for your leadership and direction. Now, here's an update on where we are with the virus. As of this morning, 7,692 San Franciscans have been diagnosed with COVID-19. And sadly, 67 of them have died. We are currently caring for 88 San Franciscans with COVID-19 in our local hospitals. That is a slight drop from last week, but remember, it is an almost 25% reduction from our peak in July. Because of our efforts, because of your efforts, such as face coverings and social distancing, we have lowered the effective reproduction rate to just below 1. Remember, the effective reproductive rate, or RE, is a key measure of how fast the virus is spreading. It's the average number of people who become infected by an infectious person. If our RE factor is above 1, the virus will spread, and it will spread quickly. When the RE factor is below 1, the virus is slowing. For the past few days, and I emphasize this has only been for the past few days, and this is an estimate, but our best estimate is that RE has been just below 1, between 0.98 and 0.95. We continue to exceed our daily testing goals and to lead the state and the nation in testing. And in this next phase of our testing strategy, we will be more targeted in our testing, even as we expand testing capacity in the city. Last week, we brought mobile testing to communities with the highest infection rates of COVID-19, including in the Bayview, Sunnydale, Tenderloin, Mission, and the OMI. We are indeed following the data to identify the communities where testing can have the greatest impact to identify, mitigate, and slow the spread of COVID-19. And as you saw in the budget presentation, the mayor is proposing a nearly $56 million investment in testing alone next year. We are currently finding about 85 new cases of COVID-19 every day. That number has started to drop from its high point a few weeks ago, but it is still a cause for great concern and could easily go up again. This is one of our key health indicators. Anything above 50 new cases per day puts us in the red zone on our highest alert level, and we have been there for the past 7 weeks. So, even as we see some of our numbers improving, let's stay vigilant. We have recently seen issues with the state reporting system that may have undercounted cases on a statewide basis since July 25th. Governor Newsom has assured us that statewide data will be back on track this week. We see many San Franciscans covering their faces. And recent research indicates that if 80% of a population is regularly and properly using face coverings, we can prevent outbreaks of COVID-19. Please be one of those 80%. Thank you to everyone who is doing their part to reach that critical mass. Why don't we make it 90? Why don't we make it 100% of people wearing face coverings in our city? We know, unfortunately, that some people are not covering their faces consistently. I see some people trying, but maybe they don't know that their nose and mouth both need to be covered. Maybe they don't know that face coverings are required in San Francisco for everyone age 10 and up, and whenever within 6 feet of other people. If you have any question or any doubt, wear a facial covering. It's the right thing. It's the safe thing to do. It's like remembering your wallet or your keys. Remember your mask. This is a good habit to develop and a habit that we're going to need to have with us for some time. My mask protects you. Your mask protects me. This is something we can all do, and indeed we must do for each other. We must keep up our momentum and stand our ground and sustain our gains and continue to make progress. We are seeing some hopeful signs, and as we've seen before, this virus is persistent, so we cannot let our guard down. So please, again, continue to do your part. Continue to take caution and care. Take care of yourself. Call your friends and family. We are all in this together, and we will get through this together. Together, we have the power to save lives and, again, crush that curve. Thank you.
Thank you, Dr. Colfax and Madam Mayor, for your time. We will now begin the Q&A portion. First, we have testing and healthcare-related questions for Dr. Colfax. Doctor, the first set of questions are from Lydia Chavez with Mission Local. What specifically is the city doing to shorten the time it takes to get test results and to bolster contact tracing?
So thank you for the question. We have really caught up on our local testing turnaround time with regard to our public health lab and through City Test SF. Those turnaround times have averaged generally 48 to 72 hours. A few weeks ago, we did fall behind because of the great demand and surge for testing. We have now caught up on that and are increasingly looking to expand our City Test SF capacity. So those turnaround times for testing will continue to hopefully be shorter than they were just a few weeks ago. With regard to contact tracing, we've trained nearly 300 people in contact tracing. Again, we are starting to catch up from that glut of cases, and the numbers are improving significantly from where they were just a week or so ago. So making great progress in that while we expand our testing capacity, continue to expand our contact tracing, and as you will see in the mayor's budget, there are investments to strengthen that work going forward.
Thank you, Doctor. Lydia's follow-up question is, have any outbreaks been traced to a gathering in Dolores Park or on Valencia Street? Where are the outbreaks happening?
So we know that outbreaks occur when people gather. We know that indoor gatherings are more dangerous than outdoor gatherings, but certainly there are significant risks with outdoor gatherings. And we really want to emphasize that people need to wear facial coverings, including when they're outside, when they are within 6 feet of each other, and that it's just best not to gather if at all possible. For people who are doing essential work and need to work in close proximity, we need to have that happen, but let's not gather for things that could otherwise be delayed or be done on Zoom or in other virtual ways. With regard to specific outbreaks, I can't comment on drawing conclusions from the gatherings at Dolores Park, except to say that is risky behavior. We're very concerned about it. And our message continues to be, do not gather unless absolutely essential. Do not come into close contact with people outside of your immediate household whenever possible. And if you do, wear those face masks, use that good hygiene, and socially distance whenever possible. And look, when I walk around or drive around the city, we know that unfortunately this is still not happening to the degree that it needs to be. We need to hit that 80% mark. Let's go for 100% with a facial covering and adherence to everybody doing their part to crush this curve.
Thank you, Dr. Colfax. The next set of questions are from Janie Har with the Associated Press. How has the state's problems with CalReady affected San Francisco's effective reproductive rate?
So our effective reproductive rate is really based on the number of hospitalizations in the city, and the CalReady system data is not part of that calculation. So we are confident in our ability to estimate the effective reproductive rate based on the hospitalization data in the city.
Her follow-up question is, how can we be sure cases are going down if there is underreporting by the state system?
So the number of hospitalized cases are going down in our city. So that's what we base the reproductive calculation on. So it's on those hospitalization numbers. The case rate, the diagnosis, the number of people diagnosed with COVID-19 based on testing, that number could change based on the correction from the state. We hope to have that corrected. That we are expecting that the state will correct that by tomorrow, so we will be watching that data very carefully.
Thank you, Doctor. The next set of questions are from Aiden Vaziri with the San Francisco Chronicle. What are the major factors contributing to the numbers leveling off? So
what we can't draw any one action with regard to cause and effect with regard to the decline in the number of cases. But I do think that a few weeks ago, our recognition that we were in the midst of another surge and that the reproductive rate was going up rapidly. It was going up on a daily basis. That we worked with community members, key stakeholders, physicians, clinicians, and people in neighborhoods most affected by COVID-19, particularly in the southeastern part of the city, and really worked to get the message out that everyone needed to be aware of this, to access testing if you were in an area that was experiencing an outbreak, to wear those facial coverings, to socially distance, and to not gather. And I hope that given those efforts and the messaging, that people heard this and that people are doing their part to, again, flatten and hopefully crush the curve. I will say that the reproductive number is just about at 1 now. We need to see that trend continue so we get much lower, but I am hopeful that we continue to go in the right direction.
Thank you, Doctor. Aiden's follow-up question is, have you considered further restrictions or enforcement measures for places where people are not complying with public health guidelines?
So we've been very thoughtful about how we enforce the restrictions, and I think that we know from good public health data and working with community for many years in the public health field, that the best thing to do is to support people and to give them the resources and support and information and assistance that they need to comply with the health orders and the recommendations of the health department. So we really want to focus on engaging with key stakeholders, with community members, with families and residents, so that they understand what it means to take these preventive measures, and to make sure that they have not only the facial coverings and the education from a public health perspective, but those all-important wraparound services, things like food security, hotel rooms if they need to isolate and quarantine. So really thinking in a broader, more holistic sense in terms of how we support people in adhering to these orders and guidelines with regard to preventing the spread of COVID-19.
Thank you, Dr. Colfax. The next question comes from Nicholas Chan with SF Examiner. Business owners from the spa industry and other personal services have been frustrated that they cannot fully reopen even after proposals of phased reopenings and sanitation guidelines. What are some of your concerns, and also what are the limitations of decision-making for local public health officials?
Thank you for the question. So right now we are on the state watch list, and we've been on that state watch list since late July. So no further reopenings can happen until we are off that watch list and we receive updated guidance from the state with regard what might be plausible to reopen going forward.
Thank you, Doctor. Our next question comes from Dan Kerman with Cron 4. If the reproductive rate, which you said is not below 1, is only based on hospitalization and not positive tests, then it does not include asymptomatic people. So how is that number viable?
That's an excellent question. So the reproductive number is an estimate. It's an estimate that we have been working with UC Berkeley and UCSF, Cal and University of California, San Francisco, researchers with regard to developing a model that takes exactly that into account and uses the hospitalization number and extrapolates that to the broader population at large to come up with an estimate of the reproductive rate. It's publicly available with regard to what the reproductive rate estimate is, and you can dig deeper into that methodology on the public website, which we can certainly supply to you.
Thank you, Dr. Colfax. There are no further questions at this time. This concludes today's press conference. Thank you, Madam Mayor and Dr. Colfax, for your time.
Hiya, you're watching Ireland 1, the only channel on the